Okay, so a couple things. First, I'm fighting a chest cold, so if I cough or whatever during this, or I sound funny, that is why. Speak of the devil. Oh my gosh, spoken into fruition, that's awesome. Second thing is, I'm pretty sure in my last video I talked about how I don't like to be scripted or things like that. That being said, someone is a little bit of a perfectionist. And we've already made this video, and I was in the middle of uploading it. By middle, I mean I was at the end of uploading it. She's like, "There's more I wanted to say."
There was more. I was like, "We left out this and we left out that," and I'm like, "We've got to make it right."
Okay, so we're redoing it.
So here we are again.
Not scripted, just noted, right?
Just like bullet points, so I don't forget.
So this is my wife. Her
Hi.
name's Carissa. Little back. Do you want to just introduce yourself? I guess.
There's not much. I don't know. My name's Carissa. I'm Hayden's wife.
What do you do? What do you like to do?
I'm a nurse. I've been a nurse for, what has it been, 13 years?
Uh-huh.
I work with some awesome veterans, so that's fun. And I don't feel like I have a lot of stuff I like to do right now because it's just being mom. I don't feel like I have my own, like, I just don't have hobbies right now. But if I did, I would like volleyball and just being outside. I don't know.
Well,
Random
awesome.
stuff like that.
Yeah. Well, sweet. So this video is just going to be another talking video. It's going to kind of go through my diagnosis. I think my last video was just kind of a brief overview of everything. And there he goes with the ums again. It bugs me so much. And then when
Should we put a counter in the corner?
Yeah. It's a drinking game. So, yeah, my last video was kind of that brief overview of everything. This one is just going to go strictly through my diagnosis. These videos, like I said before, are mainly going to be for my girls. It's just so they have, videos of me. I do have some very personal videos I've made for them for big life events that I may miss, but I feel like, and I've been asked to, that this might be able to help some other people, especially with my outlook. So if it helps somebody, awesome. If it doesn't, great. So let's jump into the diagnosis. It started with me going to our family doctor. I
think it started with me forcing you to go to a doctor.
Yes. So there's a couple things that kind of set that off. Is I had an ocular migraine one day. I don't know if you've ever had them. I've never had them until this one incident, and that's the only one I've ever had. But your vision actually just starts going out, and I was driving at the time. I'm like, oh crap, this isn't good. So I just had to go to an office and just take a 15-minute nap, and I was fine. I'm like, but that was a little sketchy. And then I talked about my grip strength and things like that. Then with the, I went and talked to my family doctor about, these are some of the things I've seen. And even so, in my line of work, we wear body cams, and I remember I was reviewing a body cam for a case, and as I'm sitting there, I'm looking at my arm, and my bicep is just twitching. And I'm like, that shouldn't be cool. And so I brought that up to him, and so he ran through all the basic tests, basic blood work. He ordered a CT scan of the brain. Anything come back with that?
No, it came back clear.
Oh, yeah. Yay.
From my memory.
Yeah. So he just told me, well, I can order a nerve scan, or what is it called?
EMG.
An EMG. I'm going to call it a nerve scan because it's a nerve scan and they scan your nerves. And all that is, and I shouldn't say all that is, it kind of sucks. They have a couple, I want to say a couple needles. I know one prominent needle that is like a microphone, and I shouldn't say like, it's a microphone that they stab into you, and then they shove the other needle in other places. So they were doing it basically in my upper arms down to my lower arms. So we started off with just the upper body. And that, he's not a neurologist. I don't know what his title is. He's a scanner or something.
The scanner guy.
The scanner guy. He was, all right, well, I want you to meet with our neurologist. He's very good at what he does. And side note about the neurologist, I'm not happy with him. And I don't want to say it's because he gave me, a diagnosis of a terminal illness. That's life. Crap happens sometimes. That doesn't bother me. What bothers me is the way he handled it. But we'll get into that. So the nerve scan guy, I feel like there's a better title
I'm
for
sure
him.
he does have a title.
Probably not. Nerve scan guy. Okay, well, I want you to meet with our neurologist. He's really good, but he's super busy. So he set up an appointment for a few weeks out. I think it may have even been a month.
Something like that.
It was more than that because it was into September of last year is when they wanted me to go. And I'm like, all right, sweet, sign me up. Well, a day or two later, I get a phone call from the nerve scan guy. It was like, hey, we want you to come in sooner, and we want you to do a lower body nerve scan. So I'm like, awesome.
Well, that's because of your results.
Yeah.
What did they say?
Thank you. So basically, he told me that I had significant nerve damage. Well, he didn't tell me this yet. It was, we want you to come in sooner, and he's going to actually meet with you a lot sooner. And I'm like, well, that doesn't sound good. I'm not a doctor, but I don't think that's right. And I remember texting my brother and my dad and was like, hey, they're like pushing this appointment up, and bless their hearts, just super optimistic. Oh, they probably just had an opening. I'm like, I don't think so, but cool. So I go and get the lower nerve scan done. And while I was talking to them, or to him, I was like, so what's with the urgency? Why did we push this so quick? And he was kind of beating around the bush, and I understand why. I don't think he's certified into diagnosing or things like that, so that doesn't bother me. He's like, well, there's just some things we looked at, and he told me that there was significant nerve damage in my upper body. I'm like, okay, it's weird. But whatever. My lower body showed little to no nerve damage, and we ended up meeting with the neurologist. Not the neurologist. We met with the physician's assistant, and so this all happened within the span of maybe a week, if I'm remembering right.
Probably.
And so it was really quick, and I didn't think it was going to be anything. Like,
Same.
I don't know, you're out of shape, go deal with it. I'm like, cool.
Or like, you have like a deficiency in something.
Yeah.
Take this medicine and you'll be better.
Yeah.
Yeah.
But so we meet with the PA, the physician's assistant, with the neurologist, and she basically run me through a field sobriety test, which I do a lot of at work, like a lot of them. And I felt like I passed them. I wouldn't have arrested me, but apparently she's looking at other things. So they also checked, I mean, it was beyond just like the one leg stand and the 9-step walk and turn. It was also They'd have me bring my arm up and pull down on it or push back and just have me resist. And I felt like that was fine. They checked reflexes on your feet, knees, hands. They checked my tongue. I think the biggest sign, I guess, would have been my fingers. Is basically they have you hold your fingers out and you don't let them push back in.
Yeah, it's like you push.
Well, you're pushing my whole hand. But
Well, example.
yeah, see, can't really hold that back. But so the PA leaves and go gets the neurologist and brings him back in. Oh,
Can I add something in?
no. Yes.
Just what I thought of with his exam is the reflexes. Like, I thought in my brain, if something was wrong, he wouldn't have a good reflex, but he was having great reflexes in my mind. But what it came to be is that he was having...
They're over-exaggerated.
Yeah, it's like hyper... I can't remember the term of it.
Over-exaggerated.
Yeah, so a normal person, you know, his knee would kick a little bit. His was kicking like way too much. So that's something that's a sign.
Yeah.
A symptom, I don't know. Whatever it may be.
So, the neurologist and the PA came back in, and I'll go through my version of kind of getting the news versus she'll go through hers. And so, mind you, it's not just us there. Our two oldest were in school, and we had our youngest with us, who was, what, 3? She was 3 at the time. So, and I touched it on this briefly in my last video, was the neurologist came in and said, you have ALS. And this is where I don't want people to get confused. I'm not upset with him because he gave me that diagnosis. That's life. It happens. You know, you gotta roll
Someone's
with it.
got to give it.
Yeah. The way he gave it, I don't think I would want it another way. Don't beat around the bush. Just come out and tell me, which he did. As he's talking, my first instinct was to go to Google. Google knows everything. And I don't know why this was the question I asked, but it was life expectancy of ALS. And 2 to 5 years popped up. And I just remember looking at her and just go, I should not have Googled that. And I showed her, and oh, that sucks. So you're giving me this life-altering news, and your next question is, do you have any questions for me? And I'm in shock. I mean, what do you say? Like, even going back right now and rethinking about it, I don't even know what questions I would ask, because you're being told, hey, you're dying. What do you want to know? I don't know. Google told me the main thing, so that sucked. And I didn't say that, but and this is kind of where I get upset with this particular doctor. Was we told him no, like, no, we don't know. We don't know if we have any questions. We're good for right now. And we sat there for 5 to 10 minutes of just going, this sucks. And they were kind enough to let us do that. I mean, it wasn't like they came right in and kicked us out. But before I get into what really irks me about it, I guess I'll let you say your side, and then we can get into how we
Okay.
don't.
So my view of how it kind of went down was, like, the doctor comes in, I'm trying to like wrestle a 3-year-old. She's getting into things, you know, she's just not sitting still, of course, like a 3-year-old would do. And I'm trying to keep her
He's
entertained.
a little extreme.
She is. And So he's starting to be like, so what do you do for a job? Is there anything else you can do? Like, he's literally like just tiptoeing around like, what are you doing as a job? Do you have another option?
Yeah, I
pretty
tell
much.
him I'm in law enforcement. Oh, well, do you have another option? Is there something else you can do? I'm
Yeah.
like,
So then I'm kind of like, things are like flagging for me, and I'm like, what does this mean? Like, why is he asking those things? Like, that's weird. That's not normal. And then he pretty much, was just like, I think you have ALS. And same, like, I blanked. I think all I got out, if I remember, is there's no cure for that, right? Because that's just like all I could remember was like, there's no cure. I'm like, I don't remember what this is, but I'm like, there's no cure. And he's like, yeah, there's no cure. So then I'm kind of like, huh, okay. And and Oakley's still trying, going all over, and I'm just trying to, like, just blank. And it's like, do you have any questions? And I'm just like, I kind of look at Hayden, and I'm just kind of like, no. Because I've just gone. I don't know. I'm like, here I am in the medical field, and I can't even ask a question. I just went blank. And
yeah, it sucked. But that leads us into kind of our angriest point in this, or at least our angriest point at this specific doctor, was he leaves, him and the PA leave, which is fine.
I will say, I remember, he did ask, do you want a second opinion?
Yeah, he did.
Which, my brain at that moment was kind of like, well, you already just gave us the diagnosis, like, why do we need someone else to tell us the same thing? So I think we both said no.
Yeah.
Yeah, I think we're like, we're good.
Don't need to go through all this.
Yeah, there's no need to do this again.
And so before they left, I mean, he told me I have ALS, but then in the same breath, it was still, there's nothing that tests specifically for ALS. We have to rule everything else out. So there are some other things that they ordered. Another MRI, because I had an MRI of my head, of my brain. This one they wanted the full head and to my shoulders, checking my neck in case there was any like bulging discs or things like that, because if that happens, it can mirror these symptoms. So we have to rule that out, but it still told us we have ALS.
And Lyme's disease.
Yeah, and did a Lyme's disease screen. So there was a bunch of other things that I still had to go through. But he leaves, the PA leaves, and we're sitting there. And, I mean, this sucks. Like, I don't even remember what was said. But we ended up going, okay, we need to get questions. Like, is this hereditary? Do I have to worry about this with my girls? And I don't know, I'm sure there's a few other dumb little questions, but the CNA finally came in, I don't know, 5-10 minutes later. It probably felt longer than what it actually was. And she's like, oh, you guys can go now. And I'm like, well, we have some questions for the doctor now, so if we can have him come back in, that would be fantastic. And she goes, oh, okay, let me go get him. So she comes back a couple minutes later and goes, so the doctor's with another patient. And I'm like, all right, well, I get that. Like, we all have schedules to keep. I don't want to...
We don't want to take from somebody else.
But, I mean, on the same note, you just told me, hey, you're dying. Maybe pencil in a minute for me.
Well, my view is you just told a 32-year-old that he's dying, and it's like he's got a 3-year-old child sitting with him.
Yeah.
I don't know. It just felt bigger to me, of just like...
It felt like he just kind of brushed it off.
Yeah, it's like, here you go, here's that diagnosis, and see you later.
So, we're like, well, can we leave these questions? And yeah, that'd be great. So I think you even went in, because it was on the back of the order form for like the Lyme disease and the neck
she took
MRI.
A copy of it.
So she photocopied the questions.
With my shaky, scared handwriting. It probably looked horrible.
And so it's been, what, a year and a week since we got the diagnosis, and still haven't heard back about those questions.
Nope, never called.
Maybe we should call him. So go through and we do the neck MRI and all that, and she's the one that dealt with them on that one. Well, I guess it wasn't even then, because our primary care got the MRI back and set up a telehealth with us, and basically meeting with the doctor over internet. And he goes through and he's like, well, these look normal, and I'm not a neurologist, but this is kind of what I'm seeing. Playing that doctor game of maybe, maybe not, covering my bases, which is fine. I'm not complaining about it. I just think it's funny. And he goes, so did they tell you anything? And I'm like, yeah, he told me I have ALS. And he goes, what? And he was shocked. He's like, I'm like, did you not know? Like, did they not tell you? And no. And he was, I mean, I would say he was pissed. Just, that's not how he should be finding out. Especially when he referred us over there, they should be in communications, which turns out to be not this neurologist's shining moment. Is
strong suit.
Yeah, his strong suit. So when finally the neurologist calls us back with the MRI, you're the one that they called.
Yeah. I wish that their techs, or whatever they're called, would understand the news they're giving, because she had called me and was like, hey, great news. She's like, we didn't find anything in his CT scan. Like, everything looks great. Like, and we're good. And I was like, huh. So I was like, so my husband still has ALS? And then that got awkward. She's like, didn't know what to say on that one. And I was just like, whatever. I was so done with that place at the moment, because I just wish they kind of knew that. I don't know, that we were looking for ALS, and they could have delivered the news a little kinder.
But yeah, I mean, that sucks, but it is what it is, right? You just gotta keep putting one foot forward and going and doing the best you can. So we never went for a second opinion, at least not that I knew we were going to get, but we went up to the ALS clinic here in at the State University.
Wow. Sorry. Because we weren't told anything, I became the investigator, because Hayden didn't want to find stuff out. He was completely fine not knowing things, but I was not. I
don't see why focus on the negative. I don't see why focus, hey, you're going to be in a wheelchair. That's going to suck.
Yeah. So that fell on me, which is fine. I like sat and researched everything, and I'm like, how do I get my husband help? Like, how do we figure this out? And I come to find out that there's an actual ALS clinic here in Utah, which we weren't even told about. So me and Hayden's mom were able to work on getting him an appointment up there. And yeah, I think that's where you were going, right?
Yeah. But yeah, it was, again, when we went in there, they were doing another nerve scan or EMG, whatever you want to call it. And all of them, you don't have ALS. You don't have ALS. You're too young. And I'm like, okay, well,
they're
cool.
Like, yeah, we don't think he has it, blah, blah, blah. So they're like playing it off all nonchalant, and I'm just kind of like,
And I'm like, cool, that'd be great news.
That'd be awesome.
I mean, I'm told otherwise, but cool, not a doctor. I'll do whatever you tell me. And we go do the EMG, and oh, shoot, yeah. I'm like, cool.
Like, yeah, you do have it, yeah.
So they've actually been really good to work with.
Yeah.
ALS clinic. That's all they deal in. So it's been really cool kind of seeing that. And I think that's something we can get into more in another video, because this one's already gone way too long. Right?
Sure.
I don't know. We're not even doing anything fun.
I know. We're probably boring.
Oh, well. But like I said, I really want to make these for my girls, just so they have some extra videos of me for when I'm not there. And I don't remember if I said this at the beginning of this video or if I said it in the other video you made me delete. And if I did, oh well. But like I have some really personal ones for my girls. Like I have group ones for them, like group videos for them, and extremely personal ones of just for them, for specific times in their lives or memories I have of them. And those will not be shared except to them personally. But I've been told, with my outlook, I'm sure you've seen me sitting here smiling and laughing about stupid stuff during this. I have a very good sense of humor about this. I mean, to me, I can sit here and be bitter and pissed off and just piss away the remainder of my days. But that doesn't do anyone good. That doesn't do me good. It doesn't do Carissa good. It doesn't do any of my girls good. I want to make the most of this while I have it. And I've also been told, there may be people out there that will look at my outlook and maybe give them some strength. So if you're going through something and this gives you some strength or a better outlook, great. If it doesn't, oh well, get over it. Yeah, anything else?
Hashtag life's too short.
Yeah, some apparently.
Mm.
But yeah, we'll get into some other just sit down videos like this. And I kind of want to do some like vlog type things on our family trips or things, just so the girls have those memories to fall back on, and y'all can be here for the ride. Anything else?
I don't think so.
Okay. Bye.
Hayden Carissa out.
Okay. No, we're not doing that.